There have been a lot of assumptions made about ketogenic diets over the years. And guys, I've been around almost 2 decades. I have heard everything under the sun said about carbohydrate restriction. I mean, everything. And when I first came on the scene in 2005, after I lost weight in 2004 on the Atkins diet, man, you should have seen the onslaught of how they tried to mire and taint the low-carb diet. I was just like, why? Like, what's the point? It's helping some people. Okay, you don't happen to like it, but that's irrelevant if there are people seeing benefits from it. I never have understood why there's such a vitriol, other than, yes, the obvious, the pharmaceutical companies are losing patients and customers if people get off of medication. So I get that aspect of it. But just from a medical standpoint, trying to help your patient get better, wouldn't you want to give them every option on the table? I think so. Carbohydrate restriction and mood. A burgeoning literature does not support any negative impact of carbohydrate restriction on your mood. In fact, there is a small but growing literature that focuses on potential mood stabilizing factors of the diet, particularly amongst those individuals who have bipolar. When I wrote Keto Clarity, you guys, one of the things that I put in there that we have emerging science on is that it helps with bipolar disease. And so they're right. We've known that. Those studies are already out there. Researchers theorize that changes in the brain, for example, the switch from utilizing to utilizing ketones for energy instead of glucose, could be what's affecting mood. Well, yeah, those ketones directly feeding the brain, ketone bodies are the preferred fuel source for the brain. So it makes sense that all of the things that would exacerbate brain health and cause your mood to be in a depressive state would switch once you change fuel sources for said brain. It makes so much sense. Why isn't this common knowledge? In addition, a handful of studies have explored the impact of a low-carb diet on mood and other psychological outcomes amongst patients without mental health conditions or without diabetes. The majority of those studies identified either modest improvements or no change in their mood or other indicators of psychological well-being. There have been a few longitudinal studies identified short-term improvement followed by regression back to baseline mood. However, there are many reasons to expect that a low-carbohydrate diet could have a positive effect on mood in those people who have type 2 diabetes and other metabolic conditions. First, higher glucose and inflammation are linked to metabolic syndrome, diabetes, and depression. Isn't that interesting? So just the mere presence of higher blood sugar and higher inflammation levels actually links the connection between metabolic syndrome, diabetes, and depression. If you're one of those people who suffers from depression and you happen to have metabolic syndrome and you happen to have diabetes, have you ever made this connection before? Has any doctor ever brought this to your attention that, hey, you're depressed because the diabetes is out of control. Let's get the inflammation down. Let's do things that are anti-inflammatory. Let's get that glucose under control. And this is why I know more people would buy into the keto message if they heard that from a medical professional. And I've literally never heard this association before, which is great that they did a study on this. Thus, improvements in glucose and inflammation observed with a low-carbohydrate diet could have a very positive influence on those depressive symptoms. For example, data from the Diabetes Prevention Program suggests that it is not the diagnosis of diabetes that increases the risk for depression, but rather increases in your HbA1c and fasting blood glucose level that follow the diagnosis. Isn't that interesting? It's not the diagnosis itself. It's those increases in the blood sugar that follow the diagnosis that leads to the depressive symptoms. It's all connected. And look, if you know somebody in your life who has type 2 diabetes and they're dealing with out of control blood sugars and they're dealing with depression and they keep, especially if you're like a coach of clients and patients, and they keep coming to you. "Oh, I just feel so bad. I just feel so horrible." Well, here's why. Your high blood pressure, your high inflammation. So let me help you get those things under control and watch your depressive symptoms get better. It's a good buy-in factor for those of you that coach people and have patients. Furthermore, improvements in the HbA1c have been associated with decreased depressive symptoms in adults with type 2 diabetes. Second, the majority of people with type 2 diabetes also have obesity, so the whole diabesity pandemic that we have. And the low carbohydrate diet is associated with clinically significant long-term weight loss, substantial weight loss, such as that experienced following bariatric surgery, is also associated with an improvement in depressive symptoms. So there's an argument for lose weight, and that also will help with the depression. Third, a low-carb diet tends to reduce dependence on all the anti-glycemic medications, which is aligned with patient preferences and avoids negative secondary consequences of these intensive therapy regimens, including the risk of hypoglycemia and a reduced well-being. Look, nobody wants to take medications. Yes, I know there's some people who say, "I'd rather do the medication than do the lifestyle change you're recommending," but I think for the most part, most people would rather not have to take any drugs at all. A few small studies have examined changes in psychological well-being among people with pre-diabetes or type 2 diabetes in the context of a low-carb diet. Results were mixed, with some indicating psychological well-being, being in diabetes distress, as they call it, improving, and then others saying it just stayed the same. However, the sample size in those studies were so small and time limited that carbohydrate restriction may have reduced the power for these analyses of the secondary outcomes. Did you go keto and thought you had to give up wine? Well, let me introduce you to Dry Farm Wines. It is the world's first sugar-free alcohol that is lower than your typical wines, organic, made at local farms that do it the right way. Most of the wines that you buy are from 3 really big companies, loaded with additives and preservatives, so many dozens of those kinds of things. You don't want all that junk in your wine. So go to dryfarmwines.com/Jimmy and they will ship you these wines. And just because you listen to this podcast, Dry Farm Wines is going to give you a bottle in your first order for just 1 cent. Go to dryfarmwines.com/Jimmy and you will get your bottle of wine for just 1 singular penny. Go check them out. Dry Farm Wines, you guys. It's wine o'clock somewhere. Let's go get some wine. You came in late. Virta Health has a brand new study that they just released a couple weeks ago in the Journal of Behavioral Medicine. Depressive symptoms improve over 2 years of type 2 diabetes treatment via a digital continuous remote care intervention focused on carbohydrate restriction. So we're getting to the meat of the study, all pun intended for ketogenic carnivore diets. Current study. Given the many reasons people with type 2 diabetes may experience mood benefits from a low carbohydrate diet, we conducted a secondary analysis of 2-year data from the ongoing 5-year clinical trial of a continuous remote care intervention to explore changes in depressive symptoms. So yes, this Virta Health study has been going on for half a decade. And so they're taking some of the data points during their study to then pull out and make these studies. So as part of the experiment, participants were coached in carbohydrate restriction. They had the goal of achieving nutritional ketosis. They defined that as any level of beta-hydroxybutyrate in the blood that was 0.5 millimole or higher. The 10-week, 1-year, and 2-year primary outcomes were previously published in other journals. At the 2-year mark, HbA1c had decreased by 0.9% from 7.7% concurrent, with significant reductions in the number and dosage of diabetes medications prescribed. So they've already seen in previous versions of their study that they've been able to pull people off of medications, whereas they were very dependent on medications before, and the disease was getting progressively worse and worse and worse. They were able to not only stop that, but reverse it and get them off of the medications. Weight was also reduced by 12% at the 1-year mark, 10% at the 2-year mark. Inflammatory markers and most cardiovascular disease risk factors also improved. In addition to metabolic outcomes, we assessed the patient's depressive symptoms. They did it at baseline, 10 weeks, 1 year, and 2 years. 3 aims guided the current analyses. First, we assessed changes in depressive symptoms over time via the change in the total symptom severity score and the change in the percentage of participants meeting clinical cutoffs for depression. Second, we aim to identify potential predictors of change in depressive symptoms. Was it the increase in the blood ketone levels? Was it the change in the weight? Was it the change in the HbA1c levels? How about medication use? And then finally, inflammation. They wanted to see and better understand why the changes were occurring. Third, we explored whether participants with evidence of baseline or historical depressive symptoms experienced the same metabolic benefits. Was it because their A1C got better? Did they have a better weight, HOMA-IR score, which is an insulin resistance marker, and fasting glucose? So they looked at those participants and they looked for links between depression and their treatment and engagement. So that's kind of what they were looking for with the current study. Now let's look at the methods of what they did. The participants and procedure. The detailed study design and primary outcomes were already previously published, and the current results are based on a 2-year post hoc analysis using the data that was collected from that same cohort. Briefly, this is a non-randomized, open label study including patients ages 21 through 65 years old. They all had a diagnosis of type 2 diabetes. They all had a BMI, body mass index score, of more than 25. Participants self-selected to receive the continuous care intervention or the usual care. All study participants provided written informed consent. The study was approved by the Franciscan Health Lafayette Institutional Review Board in Indiana, which is where Dr. Hallberg is located. No changes in metabolic parameters were observed in the usual care cohort over 2 years, so we limited this analysis to further our understanding. The 262 participants were provided access to a web-based software application, an app on their phone, and initially advised to achieve nutritional ketosis, get your blood ketone levels, beta-hydroxybutyrate, to 0.5 to 3.0. That was their target. Through sufficient carbohydrate restriction. Initially, they put them on less than 30 grams of carbs a day, but they gradually increased to find their personal carb tolerance and their health goals. Participants used the app to communicate with their remote care team, consisting of a health coach and a medical provider. You know, I keep imagining having an app on the phone and being able to talk to a medical professional while you're going through something like this, where you're doing carbohydrate restriction. I think that's the wave of the future, you guys. Like, how easy would it be, especially if there's like sophisticated ways to be able to communicate, but not always like in person, not always like, you know, FaceTime kind of chat, but be able to leave a message. And then when the doctor has availability to be able to respond, like, I feel like that's where medicine is headed anyway. And it's definitely going to help people with type 2 diabetes. So I think Virta Health is onto something, setting up the protocol for this study, and then it can be replicated, you know, worldwide. Participants use the app to communicate with their remote care team instead of a health coach, consisting of a health coach and a medical provider. So the health coach would be somebody that isn't necessarily a medical professional, but they have lots of nutritional health knowledge. I see several of them on both the Instagram Live and over on Clubhouse right now. So you know who you are. And so you would work alongside a medical provider. The remote care team provides education, support for the dietary changes, behavioral modification techniques for maintenance of lifestyle changes, and then for the doctor, directed medication changes for the diabetes and the antihypertensive medication. So your blood pressure will come down. You'll need to come off those medications or at least titrate down on them. All the participants use the app to upload and monitor all their biometrics, including body weight, blood glucose, and their blood ketone levels. Biomarkers allowed for daily feedback to the care team and individualization of patient instruction. How cool is that? They got to communicate, hey, here's how I'm doing. Hey, here's a concern that came up. Hey, help me.